Greetings, members of the National Association of Advisors in the Health Professions, and welcome to my video presentation. Today, I will be unmasking a work in progress that I began planning about a year ago. This project began as a way for me to help my pre-health students grow professionally and personally by connecting them to local opportunities and helping them to reflect on the value of those experiences. To this end, I launched a student-centered, co-curricular professional development program known today as the Pre-Health Experiences in Volunteering, Education, Research, and Shadowing Program, also known as the PHEVERS program. My name is Dr. Johnica Morrow, and I'm the Pre-Health Pathways Advisor at the South Dakota School of Mines and Technology. SD Mines is a small STEM institution that's located in Rapid City, South Dakota, right in the heart of the Black Hills. Our institution has a reputation for academic rigor, for involving undergraduates in cutting-edge research, and providing excellent student support services. As the Pre-Health Pathways Advisor, I work with approximately 170 students who are involved in majors across campus. We have students who get degrees in everything from traditional fields such as biology or chemistry, or our new degree in pre-professional health sciences. I also have students who pursue more of an engineering route, getting degrees in things like mechanical engineering, biomedical engineering, or even industrial engineering. The Pre-Health Pathways Office provides lots of resources for students, everything from one-on-one counseling where we will develop their personal timelines for success, both in and outside of the classroom, to helping students prepare for entrance exams and navigate the application process. Our office also helps to facilitate connections for students to help them identify professional development opportunities that can help them to grow both as an applicant and as a future healthcare professional. Like many of you, I wish that we were able to do this in person. That way we could carry on a conversation of today's topic over a delicious beignet somewhere in between sessions today. However, we've all been adapting to the changes and learning how to live in a post-COVID-19 world. I am glad that we live in a time where we are able to connect in a virtual space, so at least we can still talk, even without a yummy beignet in between us. As most of us have probably experienced in working with pre-health students, they often fall into this application preparation mentality. This occurs as students look at the list of things that make for a competitive applicant for a professional program, and they begin just checking off the boxes rather than really thinking about what kinds of skills and experiences they're learning along the way. This mentality focuses on the superficial what rather than the deeper why of professional development experiences. Conversations among pre-health advisors often focus on how we can get our students to shift from this mentality of application preparation to career preparation. These conversations then move to the question of how do we engage pre-health students in reflective practices? How do we help them to see the bigger picture of growing as a healthcare professional and not just as a person trying to get into a professional program? It was with these conversations in mind that I created the PHEVERS program for our pre-health students. The PHEVERS program was designed to meet students where they are, whether they were starting off as a freshman who just wanted to explore the different healthcare professions that are out there, or a junior or a sophomore who's just trying to gain more pre-health experiences and to grow professionally and have a better understanding of what they're getting themselves into, to a senior who's already applied and is just looking for more experiences to help them grow and be prepared to be able to thrive in those professional programs, to transfer or non-traditional students who are seeking to find their way into the healthcare profession that's right for them. I wanted the program to be flexible enough to accommodate students in different phases of their pre-health journey, help them to set some goals and figure out where they want to go, and then give the tools and resources that they need to develop the skills and gain the experiences that will help them to reach that goal. I wanted this to be a program that was helpful for students and didn't feel like another box to check or another obligation to add to the growing burden that many pre-health students carry. I also wanted the program to help students be more intentional about reflecting on the experiences that they've had and the value of those experiences. I hoped that the PHEVERS program would serve as a cohort building mechanism among members of the program, contributing to a better pre-health community on campus. The requirements for the PHEVERS program are divided into 4 major areas: volunteering, education, research, and shadowing. For volunteering, students were originally expected to gain 200 hours of medically relevant volunteerism to complete the program. After a first semester and kind of working out some kinks in the program, this requirement was changed to be 200 hours in total of any sort of volunteering, but at least 50 of those hours needed to be medically relevant. This was done so that we could keep encouraging students to engage in volunteerism in their community that may not be medically relevant, but was something that they were passionate about or that could serve in helping them to become better professionally or personally in ways outside of medicine. For education, this is split into 2 parts: education of self and education of others. On the education of self front, students are expected to attend 6 different pre-health learning experiences, and these are broadly defined. This can be a workshop or an informational session about a professional program. It can be attending our wellness fair or pre-health week activities. It can also be attending grand rounds at our local hospital, an opportunity that many of our students have enjoyed throughout their time in the program so far. On the education of others side of things, this is talking about outreach activities. This doesn't have to be clinically or pre-health relevant for the students to be able to engage in these activities and complete them for the PHEVERS program. Outreach activities are also highly variable. This can be our students talking to local high school or middle school students about what it's like to be a student at School of Mines, or about what it's like to be a pre-health student and getting ready to apply to a professional program. Other outreach activities can be done in a virtual space. For example, some of our students have been featured in the Student Spotlight on our pre-health blog known as the Atrium, because sometimes we're clever. Students have also been featured in our Hard Rocker magazine and on our social media pages through collaborations with our marketing and communications department. In spring 2020, we also attempted to do a really cool outreach activity that I'll tell you a little bit more about in the video later. For research, students are expected to conduct 1 scientific research project and to present that project in a formal setting. The project can be conducted with a professor here on campus or with a researcher off campus, and the project doesn't have to be medically or clinically relevant. It just has to give the students the experience of going through the process of the scientific method. When the students are required to present their research in a formal setting, it helps them to practice their skills in public speaking and in preparation for talking to both general audiences and to peers. Most of our students do their presentations at our annual research symposium in the spring. We've also had students give either poster or oral presentations at scientific conferences. For shadowing, students are expected to shadow at least 2 different professionals for a minimum of 50 hours. It is stressed to the students that 50 hours may not be an adequate number of observational hours depending on what area of healthcare they are wanting to go into. So this 50 hours is just a minimum and a suggestion, and we encourage students to shadow more individuals for more time as much as they are possibly able to do so. This is especially important to those early career students who are still exploring the different types of healthcare professions and trying to find the right fit for them. Other requirements for the PHEVERS program include attending monthly meetings where the topics are chosen by the students who are in the program at the beginning of each semester, as well as filling out forms at the end of each semester and completing a reflective essay about your experiences whenever you complete the program. Every PHEVERS meeting looked just a little bit different, and again, these were topics that were chosen by the students during our first PHEVERS meeting of the semester. Our first PHEVERS meeting for fall 2019 wasn't able to happen until October, so we were only able to have 2 subsequent meetings before the end of the semester. For the November meeting, students asked to be able to learn more about the research opportunities on campus. So I put together a panel of several researchers from across our university who were looking for undergraduates to help with their work. Each of the panelists did a brief presentation about their research and talked about the kinds of things that undergrads could do to help them and to get involved or create their own project. Our students were very excited to talk to these individuals and had lots of wonderful questions. and many of them followed up afterwards and are currently working on research projects. For the December meeting, students wanted to know how to make the most of their winter break while they were away from campus. So, for that meeting, I gave the students the Anatomy of an Applicant workbook that is created by the American Association of Medical Colleges, and we were able to talk about the 15 core competencies and what students could be doing to assessing where they are with those competencies and what they can do to grow in each of those competencies. While this is of course intended for students who are going into medical schools, this is a useful resource for students who are going into other professional programs as well. So we were able to have a good conversation about what a professional in healthcare looks like and have a discussion about how they can grow professionally and use the Anatomy of an Applicant tool to help them assess where they are and where they want to be professionally. Our conversations about the workbook were supplemented by a discussion on the importance of self-reflection for professional growth and development. This was especially timely because students were getting ready to fill out their first ever PHEVERS documentation form, which featured not only a way for them to document all of their experiences, but also some questions to help them reflect on the value of those experiences and what they learned from them. For the spring 2020 semester, we were able to get a little bit of an earlier start with the hopes of being able to squeeze in some more meetings for the PHEVERS program. We met in January and students selected a couple of different topics that they were most interested in discussing this year. For our February meeting, students asked what kind of local volunteer opportunities were available. So I was able to put together a panel that featured a representative from our local hospital's volunteer program, 2 different representatives from our local homeless shelter, and a representative from helplinecenter.org, a nonprofit organization devoted to connecting volunteers throughout the state of South Dakota to the different opportunities that our state has to offer in those areas. The students really seemed to like this panel, and there was a lot of good information that was shared and opportunities that our students were connected to as a result of our February meeting. The meeting that we had planned for March was supposed to be Thinking Like a Healthcare Professional, and it was going to feature a presentation by one of our local hospitalists. Unfortunately, COVID-19 had other plans for us in spring 2020. Our speaker had other obligations that she needed to tend to during this critical time in the pandemic. So instead of meeting to talk about thinking like a healthcare professional with the healthcare professional, we all hopped on Zoom so that we could have a general discussion about how things were different for the PHEVERS program and for students in general during the COVID crisis. We had some discussions about different types of volunteer opportunities that students could engage in remotely. Some of these were opportunities that they were able to take advantage of right here in Rapid City, but many of our students weren't even in the state of South Dakota. So they were able to share some of the kinds of things they were doing for their own local communities, wherever they were. This was also a good time for us to be able to talk about the kinds of changes in policy that our institution was seeing and the kinds of changes that we were going to see in the applicant cycles coming up. Some of these were still very new conversations to me as an advisor, and so it challenged me to be able to seek out information for students as those questions arose. This was also a really good time for me to be able to talk to students about being patient when opportunities that they had lined up kind of were going to have to be put on pause, but also to talk to them about how to reframe opportunities that they had lost due to the COVID-19 crisis as opportunities for them to seek other areas of professional development. Many of them were disappointed about being unable to engage in shadowing and certain types of volunteerism, but it gave us a chance to have some really meaningful conversations about ways that students could volunteer remotely and still be engaged in their communities. This was one of the most well-attended meetings of the entire year, and it wasn't even on the topic that we had originally said we were going to be talking about. I think it was really meaningful for students to be able to just have a forum for discussion and to be able to ask questions and get some guidance and clarification on what they could be doing when many of their plans had fallen through for the semester. And the next thing we knew, it was April and time for our very last meeting. The topic for that meeting was making the most of your summer break. We were able to bring in 2 admissions representatives from the University of South Dakota's Sanford School of Medicine to talk to students about the kinds of things that they look for in applications and the kinds of experiences that will help students to thrive in medical school and to be fantastic professionals after they finish their medical training. Okay, so now let's talk a little bit about this outreach project that I alluded to earlier. As sort of an experiment, we decided to have all of our students in the spring 2020 semester work together on an outreach project. This project was a collaborative effort between myself, the dean of our local medical school, and our associate director at the Museum of Geology on campus. Together, we came up with a fun event that we were going to call Minerals in Medicine. The idea was to have our PHEVERS students research various minerals and look at how those minerals contribute to human health, disease, diagnostics, imaging, or other aspects of medicine. The students would do this research throughout the course of the semester, and then in April we were going to host an after-hours event at our Museum of Geology where our students would deliver their presentations about their minerals to the medical students from the University of South Dakota's Sanford School of Medicine. The medical students would be able to enjoy some appetizers as they walked around and looked at the different minerals on display at the Museum of Geology. Standing by various minerals would be different PHEVERS students talking about the mineral that they had researched and telling them about the human implications of that particular mineral. This informal poster presentation style of event was going to be a great way for our pre-health students to connect with current medical students and to be able to give them a little bit of knowledge about an area of medicine that maybe they've never looked into before. It was going to be a great opportunity to help enrich the education of the medical students here in Rapid City while also providing our students an opportunity to engage with medical students. This would have been a fantastic event, and I know our students would have loved it. I would have loved it. Our medical students would have loved it. Our Museum of Geology would have even loved to have people there engaging in those displays in a new and different way. But unfortunately, like so many things for 2020, COVID-19 sort of got in the way. But rather than let the students' efforts from the semester where they had been researching and preparing for this for months go to waste, I asked students to write a 1 to 2 page essay about their minerals. Now that students have turned those essays into me, my colleague in the Museum of Geology and I are going to be going through those essays and creating a small digital booklet to be able to give to the USD medical students as a memory for an event we weren't able to actually host on campus this year. Many of us are still really excited about the prospect of doing a minerals in medicine type of event, and we're hoping that sometime in spring 2021 we'll be able to try this again. So I guess it's time for me to do my own reflecting on the last year as the person who was leading this PHEVERS program and watching it get off the ground and grow. We faced lots of challenges. Obviously, spring 2020 threw a big kink into our plans, but we were able to adapt and sort of overcome some of these obstacles, even if things didn't quite look the way we anticipated they would back in January. Aside from COVID-19, the PHEVERS program has faced a couple of different challenges over the last academic year. One of the first big challenges is student engagement. As I'm sure many of you can relate to in doing any kind of programming for undergraduates, you get some who are really engaged in the beginning and then just sort of drop off and you never hear from them again. So student engagement is kind of a problem that we all face in different areas of our pre-health programming, and the PHEVERS program was no different. We started with about 8 students, and by the end of the semester I had 2 or 3 students who had either dropped out or who just weren't communicating at all. By the time the spring semester rolled around, luckily we picked up some steam and we wound up with about 14 students. In the last month, I have lost 2 students and I have gained 3 more for the fall 2020 semester. So it's something that's always kind of in flux in terms of the numbers right now. And it is still very small. It's a very small chunk of our pre-health students on campus. But I think that, again, it's just because the program is new, and once we start going with it, word of mouth will spread and we'll get more students engaged in the process. So I think the big thing for the student engagement piece for me as an advisor is just to maintain the faith that if you build it, they will come, and hope that they actually do. One of the other things that I'm really trying to work on with student engagement is helping students to understand the why. Why is this a good program for them? Why is this something that's worth their time? Why is this something they should do if they want to get into a professional program, but also if they actually want to have a career in healthcare? So trying to help students see that why, trying to really address the why in my recruitment flyers and in my conversations with new students or with existing students who are not currently members of the program, that is the piece that I think is going to be the big draw, is really helping students to understand what it is and why it's worth their time and worth something that they should do for themselves. One of the other major obstacles right now for the PHEVERS program is finding funding. So our PHEVERS program has a teeny tiny budget that's part of the pre-health budget, which is part of the student success budget. So there's not a whole lot of money floating around. I am currently trying to find good grant opportunities so that I can submit some proposals and hopefully get a little bit more funding to expand on the things that we can do for the PHEVERS program. Overall, the PHEVERS program has been successful in helping students to connect to knowledge, resources, opportunities, and to each other. We've started to strengthen those peer-to-peer connections within the PHEVERS cohort, and we're already starting to see some growth after just a year. In reading through the PHEVERS documentation and reflection forms that I've had students fill out for the last 2 semesters, they seem to really enjoy the flexibility of the program, as well as the fact that the program helps to hold them accountable and to give them access to the resources and opportunities that they know are going to help them to grow professionally. Students really seem to appreciate that the program helps them to reflect on their experiences and set goals for the next semester. It also seems to be really helpful to them to have a long-term plan for how they want to shape their pre-health pathway. As an advisor, it's been really rewarding for me to see how students have grown in such a short time period and how they've really started to connect on a deeper level to the kinds of things that they're doing rather than just doing them because it's something they should do. I'm also happy to announce that we have our first graduate from the PHEVERS program. She's one of our students who completed her degree at School of Mines in fall 2019 and was staying in Rapid City while she was waiting to hear back from medical schools this spring. During the spring 2020 semester, she continued to work to fulfill her PHEVERS requirement and to grow professionally while she waited to hear back from medical schools. Recently, she was accepted into the Idaho College of Osteopathic Medicine, where she'll be matriculating in the next few months. As a special treat for you, though sadly not of the beignet variety, the student has a couple of things that she would like to share with you about her experiences as part of our PHEVERS program.
Hi, my name is Karen Hazard. I'm a graduate from the South Dakota School of Mines and Technology, where I earned my degree in Applied Biological Sciences in the fall of 2019. While at Mines, I played on the Hard Rocker women's volleyball team, was a member of Alpha Omega Epsilon professional and social sorority, and was involved in various clubs such as the Future Health Science Professionals Club. I am now preparing to head to medical school this fall at Idaho College of Osteopathic Medicine in Meridian, Idaho. I joined PHEVERS during my senior year of undergrad. I decided to join because I thought it could be helpful in preparing me for medical school and for a career as a future physician. As a PHEVERS student, I had set goals for what I needed to accomplish by the end of the year, and that helped me to keep motivated, to stay busy, and continue improving myself as an applicant and future medical student. After joining the program, I gained a lot of experience shadowing, attended more pre-health related events, and got involved in pre-health related outreach. One of my favorite parts of being a PHEVERS student was attending weekly grand rounds at Monument Health, our local hospital. These presentations often brought new ideas to my mind or broadened my understanding of old ideas. They also supplemented many things I was learning in classes and helped me understand things better or from a new perspective. It was also nice that they provided breakfast for me every Friday morning. Overall, I have been very thankful to be a part of the PHEVERS program and have Dr. J's help along my journey to medical school. The program helped me feel competent and confident in my abilities as I move into this next phase of my career as a medical student.
Thanks, Karen. While she was talking to you, I realized that thanks to the magic of the internet, I didn't have to go all the way to New Orleans to get some good beignets. Instead, I just made some of my own. So may I present to you my much tastier than they look first time attempt at making beignets. And now that we have these here in between us, I hope that we'll continue this conversation forward. Please leave your thoughts in the comments below and share with me your insights about the design, implementation, and future directions of our PHEVERS program. Alternatively, you can email me at jonica.morrow@sdsmt.edu. Thank you for your time, attention, and suggestions in helping me to better support our pre-health students at the South Dakota School of Mines and Technology. Have a wonderful rest of your virtual conference, and I look forward to seeing you in cyberspace. Be sure and get yourself a beignet. Definitely better than they look.